Now, we're trying to look at the cervix in pregnancy. You know, generally women, okay, cervix in all type of women, but we just want to actually look at in pregnancy, okay. So pregnancy comes with a lot of changes, all right. So the cervix in pregnancy, what could be the possible changes in it? So of course, one of the most known changes in cervix in pregnancy is you could actually see a thinning. All right, so there's a thinning of the cervix. It's becoming thin, so they call that effacement. All right, so others you can see other changes too. All right, but let's look at it. So during pregnancy, the cervix of course undergoes a lot of changes. So there's physiological and structural changes, okay, and everything here is due to what? The advantage of the baby, okay. So anatomical and functional changes in the cervix is the cervical softening. So the cervix is becoming soft. Normally the cervix is tough. If you try to do a bimanual examination and shift the cervix, it's usually, you know, how will I put it, is stiff. Do you understand? So the cervix becomes soft. That's what is known as a Goodell sign. There's increased blood supply, so the cervix is changing color. It's becoming bluish-purple. That's what we call the Chadwick sign. Okay, it's kind of like dark purplish like that. There's formation of a mucus plug. So early in pregnancy, in this place, there's usually a mucus plug here. So it's blocking anything from going out or going in. So it usually stops infections from reaching the baby. Okay. So cervical length and integrity. The cervix remain long and close during most of the pregnancy. Okay. So ripening and effacement. So when it is now close to labor, okay, the cervix start becoming thin. Okay, what we saw there in the picture, the length starts shortening. Okay, so clinical assessment, if you want to look at all these changes that I just listed, you can do a transvaginal ultrasound, then also digital examination where you put a gloved hand. Okay, so we learn about this because you can have cervical incompetence where the cervix is not thick enough to maintain pregnancy till labor. Do you understand? There could be infections or inflammations coming in. There could be cervical polyps or lesions, okay, coming in, leading to all those bleedings, okay, in pregnancy.